Good morning. For those of you who don't know me, my name is Evelini Tadros and I am the CEO for the Mental Health Coordinating Council. Welcome everyone to our fourth webinar on our fourth member briefing. This series is today's session is particularly on the workers' compensation reforms and the impacts and considerations for the CMO sector. Before we begin, please allow me to do an acknowledgement of country. In the spirit of reconciliation, I acknowledge the traditional custodians of the land from which we are dialing in this morning. Today, I'm on the land of the Cabrogal clan of the Darug Nation. I also acknowledge that this land was accessed by peoples of the Dharawal Nation. I pay my respects to their elders, both past, present and future, for they hold the memories, the culture and dreams of Aboriginal and Torres Strait Islander people. I recognise and respect their enduring heritage and deep connection to land and waterways. And I also acknowledge that the Uluru Statement of the Heart humbly remains an open invitation to support closing the gap. I also take this moment to recognise those with lived and living experience of mental health challenges, their advocates and allies. Your experiences continue to inform the work we do. I also extend my empathy and understanding to those who remain private and silent about their mental health challenges and/or experiences. Thank you all for joining us today. If you haven't joined an MHCC member briefing before, these sessions are designed for our members exclusively to connect and stay informed on the latest sector news and developments. And we're looking forward to today's session on workers' compensation with our wonderful panel of speakers. This meeting, as you might have seen pop up, is being recorded and will be shared after the event, but not include the Q&A section to protect the privacy of those who wish to ask questions and ultimately encourage participants to ask questions during the panel discussion. We have reached agreement with our panellists that the PowerPoint slides will be distributed post the event, and we encourage you to keep your cameras on if you're able to do so. If not, we understand and you do as you need to do. Please ensure that you are on mute until the audience Q&A portion. Finally, once this meeting ends, you'll also receive a survey at the end of the webinar or the meeting, and we welcome your feedback, suggestions and comments to help improve this new series exclusive to our webinars. Now, as we turn our attention to the topic at hand, many of you would be following or potentially be following the developments since early May this year, when the New South Wales government released proposed reforms to the state's workers' compensation and workplace health and safety systems. These reforms are a response to the growing recognition that current laws are not effectively preventing psychological injury or supporting workers experiencing psychological harm, whilst also detrimentally affecting the sustainability of the sector. The reforms include proposed amendments to the Workers' Compensation Act that aim to shift, and I quote, shift workplace health and safety laws and workers' compensation towards prevention. Since its announcement, an initial inquiry was conducted into the reforms, with the inquiry and the bill now referred to a second inquiry due to concerns about its potential impact on workers, particularly those with psychological injuries. The second inquiry is examining the bill's modelling, financial projections and its effects on injured workers and businesses. Submissions closed on the 22nd of July and a hearing took place on the 29th of July with a second hearing due on the 7th of October. Mental Health Coordinating Council has heard the concerns expressed by our members, and we provided an inquiry submission last month, whilst also meeting directly with the Treasurer's Office, Minister Cotsis's office and the State Insurance Regulatory Authority, and I will continue to meet with those parties or stakeholders. We've also worked with other New South Wales peaks to advocate for the community sector around the issue, and Debbie, our first speaker, will be able to discuss this in her presentation shortly. This will be followed by Diane Thomas and Alicia Rose from GSA Insurance Brokers, with their wealth of knowledge and experience to help unpack the recent New South Wales reforms and what they mean for risk management, cost control, and compassionate trauma-informed support in our workplaces. Please do start putting through your questions when the presenters start, and a reminder to keep your questions until after the presentation. If you wish to ask them directly, we can drop them in the chat box and we'll get to answering them when we reach the Q&A. And of course, I'll encourage people to put their hand up with the virtual hands and we can have an open discussion then. I would now like to introduce Debbie Jamieson, who is the inaugural project manager for the NGO Advisory Committee. The NGO Advisory Committee is a New South Wales health-led committee for peaks funded by New South Wales Health, and of course MHC sits on that committee. Debbie has over 30 years experience in the for-purpose sector. Prior to coming to this newly created role, Debbie was an independent consultant for 20 years, working with a diverse range of for-purpose organisations. Before that, she held the position of CEO with the disability services provider, and Debbie has also worked in the mental health and aged care sectors. Thank you for agreeing to join us, Debbie, and I'll hand over to you now.
Thank you. Thanks for that introduction, and good morning, everyone. Thanks for having me here. I'm going to talk to you a little bit about a recent survey, which I am going to pop up some slides. Okay.
Yep, good to go. Thanks, Debbie.
Can you see the slides?
Yep, good to go.
Yeah, great. My screen's just on the left. The large screen's just on the left, so I'm looking to the slide. Looking to the left. I'm looking. That's what I'm doing. So I'm going to talk to you a little bit about the survey that I conducted recently in my role as the project manager of the NGO AC. Okay, sorry, I'm not in presenter mode. Let me just. This was like a well-oiled machine 15 minutes ago, and now we've.
Let me just see.
Okay, I might just stop sharing. Try that again.
I'll just see if there's something I need to do on my end to make you a presenter. Julia, I might need your assistance.
Can you see that? No.
No, nothing's popped up yet.
Okay.
Okay, something's about to be shown. That's working. Do you want to just go through the next slide and hopefully that works? Nothing's changing over.
I'm not sure why that's.
Julia, have you got the slides and are you able to present?
Yeah, I'm happy to do the presentation,
okay.
Debbie, if that works.
Oh, there we go.
Oh, there you
That's
go.
I've got it. Sorry.
Thanks, Debbie.
Sorry, apologies. Okay. So what I'd like to run through is, well, I think Evelyn has already introduced the NGO AC to you, so I won't need to go into that. I'll explain a little bit about the survey, the distribution and the demographics of the respondents to the survey, go into the key findings and discuss some implications for the sector. So yeah, the NGO AC is made up of NGO related peaks and health New South Wales health representatives, and it's a strategic alliance, and we work together to identify issues of strategic significance and how we can strengthen and improve the system, health related systems. And so one of the strategic pillars or focus areas for the NGOC is around sustainability of the NGO sector. And that's where this piece of work sort of fits in. Who is involved? So there's a number of peaks on the NGOAC and health-related organisations. The four that were involved in this survey are NADA, which my role is based with, Mental Health Coordinating Council, Women's Health New South Wales and NCOS. And the purpose of the survey really was to get some sector-specific data about insurance premiums, workers' compensation and other premiums, and other types of insurances, and to understand how that's impacting on the NGO sector. A lot of the data that's in the public domain is around businesses, it's around households, and so we wanted to understand, what's happening for NGOs. And as Evelyn's mentioned, it's an area of increasing concern and issues are being raised frequently by providers. And we're also in this context of proposed legislative reform. So what did we ask about? So there was some organization demographic data, which I'm going to touch on briefly. Then we asked about workers' compensation, and most of the questions were around workers' compensation. There were some questions on other insurance premiums, the impact that was having for organizations, and there was an opportunity to give other feedback. So distribution was a bit of an estimate. The survey went out to the members of three of those organizations, and NCOS sent the survey out in a newsletter with a link. So just sort of based on the membership, clicks on the link, and also we have some data around. We know that organizations are often members of more than one peak. We had some data around that, so kind of calculated an estimated 127 organizations had access to the survey. 45 usable responses, so that was a return rate of 35%, which was quite good, and I think that's quite representative of that distribution. As we can see from the pie chart, 60% were medium-sized organizations, and we also had quite a good turnout there from the large and very large organizations, not so many from the small. Won't go through this slide line by line, but this was a question around the focus area of the organizations that responded. And there was a list of about 30 different types of service types. They could tick the top three that best represented them. The most commonly ticked there, 57%, was alcohol and drug agencies. And I think that's because NADA sort of promoted the survey quite heavily. But then if we kind of work up from there, we can see we've got community health, women's health, health promotion, community mental health, support services, Aboriginal and Torres Strait Islander services, and so on. So those organisations are pretty representative of the four peaks. So it's pretty much what we would expect. By location, it's mostly metropolitan and regional. As you can see, a fair number will cover the whole of New South Wales and a small number from rural and remote. I was asking this question in the survey because I thought I might be able to pivot some of the data by location, but because the numbers from rural and remote are quite small, I'm not sure that would have been meaningful. So getting into the key findings. So workers' compensation, first of all, we asked about the measures that organisations have in place to support psychological well-being, because we wanted to really understand what's already being done by the sector. And there was a list of 8 potential measures, and organisations could tick all that apply. And as you can see from the bar chart on the left, there's a big long line there by the number 8, which shows that 38% had all 8 measures in place, or reported having all 8 measures in place. One reported 9 because they ticked other and had some other measures as well. So that's pretty good. And if we look at, we can see that the numbers get smaller. The smaller the number of measures, the smaller the number of organizations. So, 67% had at least 6 or more well-being measures in place. The graph on the little table on the right shows what kind of measures they have. And that ranges from things like clinical professional supervision, flexible worker and leave arrangements, reasonable adjustments, and so on. And so the numbers are pretty good, but we can also sort of flip it over and look at the gaps. So, for example, wellbeing policies addressing risks, 76% reported having that in place, but that does mean that 24% didn't report having it in place. So, does that mean that 24% of organizations don't have wellbeing policies addressing risks? Similarly, professional development addressing risks, 27% didn't tick that. 31% didn't tick support to return to work. And these are basic things under the work health safety legislation. So it might suggest that there is a bit of room for improvement in the wellbeing measures, even though there has been, strong work done there. So the headline is really around the workers' compensation. And the data that we gathered was over 3 financial years from 21-22 to 23-24. We didn't gather 24-25 data because we were still in that financial year, so we didn't have full financial year data. So it's already, we're already now into a new financial year. But over those 3 financial years, premiums went up by 63% on average. That's the mean. And at the same time, wages went up by 22%. So we can see straight away that the premiums are going up much higher than the wages. And so what that means is that premiums as a percentage of wages have gone up by 0.77% on average. But of course, the average doesn't sort of give us the full picture. So I've done some box and whisker diagrams. Now, what we're looking at here is the percentage, the range of the percentage changes. So we can see at the bottom, there's a minus 37%. So at the bottom of the range, one organization, their premiums would have gone down by 37%. And then at the very top of the range, you can see one poor organization, their premiums went up by nearly 144% over 3 years. So that's quite staggering. The box in the middle is the middle sort of 50 percentiles. So it's kind of the middle range, and we can see that pretty typically there in the middle range, increases of 56 to 90% are common over 3 years. Premiums as a percentage of wages, the 3 boxes show the 3 financial years. And again, we can see that the general drift is upwards. The green box is sort of a little bit higher. Everything's gone up a little bit. The median is 2.9%, which is a little bit less than the average, but that's because averages and medians work a bit differently. And we can see that in the red box, where we've got those little dots at the top, 7.51% and 6.71%, they're outliers. So they're the kind of, outside the normal range in 22-23. But then the following year, 6.7 would be in the normal range, the top end, but in the normal range. So we can see that it has gone up. Now, obviously, workers' compensation premiums will go up, not just because of wages increase, but also because of claims. And we asked optional questions about claims, understand that can be sensitive data. We had 26 respondents that provided claims information. So we've got the claims over the 3 years. The column on the left-hand side, the green column, is the total claims across those 26 organizations. And it has gone up. So it has gone up from, 14, 17, 22. But you also need to bear in mind, these are pretty small numbers. So we're talking about 22 claims across 26 organizations in a year. And an increase of 8 claims over 3 years. So we're talking very small numbers. So if we start, so just to kind of keep that in perspective, really, and when we're thinking about percentage increases, this is pretty small numbers. The green column in the middle is the number of psychological injury claims. And as you can see, that's also gone up. However, it hasn't gone up as a proportion of the overall claims, not in this survey. And in fact, it went down in 23-24. It went down from 65 to 55%. So it doesn't seem to be increasing in our sample, in our survey. However, it's still high. So 55% psychological injury is still pretty high when the state average is 8%. So our industry is struggling with that. And the blue column on the right, that's those are the claims, the psychological injury claims that are related to reasonable management action. So that's things like performance management, it could be around restructuring positions, things like that. There's a number of things fall into that. And as we can see, almost all psychological injuries were related to reasonable management action. Now, that can mean all sorts of things, and so we shouldn't jump to conclusions about what that means. But it does tell us that is I guess a turning point, or perhaps a sort of crisis point where things kind of reach ahead when there's reasonable, what management might consider reasonable management action. But it's likely that there's been a series of events or a bit of a trajectory up to that point. And so I think that might be somewhere that employers can think about intervening, is how, where on that trajectory, because it's not likely to be just one event, where on the trajectory could we have intervened to avoid a psychological injury or a claim. Because we had 26 organizations that provided claims data, we were able to kind of map the premiums, wages, and claims and try and see what sort of patterns emerged. We can see that, not surprisingly, that organizations where wages had gone up a lot or where there had been claims history, they were the ones experiencing those big increases mostly. But there were also some very strange things that we were seeing. So, for example, 89% increase in premiums. This was one organization had an 89% increase in their premiums over 3 years. In that time, their wages had gone down by 3% and they'd had no claims. And these weren't one or two isolated cases. There would probably be about 20 to 25% of cases had these strange anomalies where we're going, well, that doesn't seem to make much sense. And, that's obviously a big challenge for employers, because how do you control costs when you don't know why the costs are increasing, or it doesn't seem to be anything you can do as an employer to help that. We also asked about other insurance premiums, not in so much detail, but again, we can see, this shows the range. The average, I think, was about 22 or 24%, and the median was around 20%. So, similar. Again, a massive range. And this is across all different insurance types. So there are lots of reasons for these changes, but overall we can see, it's not unusual to be having increases of, 50, 60% across other insurance premiums as well. So what's the financial impact on organizations? Well, 62% reported drawing down on their reserves to pay for increased insurance premiums, and a concerning 40% reported reducing staff and or services to pay for premiums. And then we asked about other impacts. There were 30% provided data on that. And as well as, again, mentioning the reduced staffing and services and drawing down on reserves, organizations were doing things like seeking other funding, grants and other funding to cover insurance premium costs, and spending less on other things. And that might include improvements to services or new services and programs. There was one organization that had said there'd been no financial impact, and the organization that said increased coverage and staff wages, I'm not actually sure what that related to. We gathered some qualitative feedback. There was quite a range of qualitative feedback, but some of the themes were, well, just confirming that premiums have continued to increase in that trend in 24-25, the financial pressures that's putting organizations under. It was also pointed out that we work in an industry where there are increasing it's complex and it's challenging work, and people work in these challenging environments, and so the workers' compensation is an important protection for people who are at risk of psychological injury. One of the challenges of One of the impacts of cutting services and cutting staffing to pay for increased insurance premiums is that you then increase the workloads of the people who remain and increase the pressure on the people who remain, and then increase the risk of psychological injury. So it becomes a bit of a vicious cycle of having to make cuts to pay for the insurance, but then that puts more pressure on staff. They're more at risk, more injury, increased costs, etc. So it's quite difficult to then get out of that cycle.
Debbie, just 30 seconds or so to go.
Okay, so I'm not going to go through this slide because I kind of cover most of it on the next slide, but just implication for our sector is making sure that funding bodies are aware of these compounding costs. It's not just about award increases. We have all these other employee costs. And so the survey confirmed, the insurance premiums are escalating, that it's having a serious financial impact, that there is a need for transparency in how premiums are worked out, that psychological injury is prevalent in our sector, and that although lots has been done, more can be done, and that having access to some good data that's sector specific that helps us to develop some preventative strategies that work in the context would be really useful. That's me. If anyone has any questions, quite happy for you to contact me directly, and there's a link to the full report as well in the slide deck.
Thank you so much, Debbie. I know that our members have, for many years now, been talking about the anecdotal evidence about their premiums increasing, and those anomalies that you spoke about with the increase in premiums where there's been no significant comparative wage increase or claims, and therefore it was really essential that we embarked in this project. So we're really grateful to you for having led this, because this data then allows us to go back to each department and say, well, you need to increase funding to align to this, because this isn't just about claims, and also to the Treasurer and to Minister Kotsis to kind of say, well, the system needs to be reformed, otherwise our services are going to remain unsustainable. But also, prevention is, better than, I know I use the terms cure, but prevention is important, so that we don't actually end up in this claims fiasco that we're in at the moment. So thank you, Debbie, and thank you also to NADA and the other peaks who came together to try and drive this initiative and provide the evidence to inform the changes needed. So that then takes us to Diane Thomas, and Alicia Rose from GSA Insurance Brokers. Diane Thomas is the head of workers' compensation at GSA Insurance Brokers, with over 20 years of experience in managing complex claims and driving strategic improvements across workers' compensation policy and claim management. Known for her commitment to operational excellence, Diane brings a forward-thinking and compassionate approach to workers' compensation, risk management, and regulatory compliance. Diane is deeply attuned to the unique pressures faced by clients in the mental health industry and the profound impact that workplace injuries can have on individuals and teams. Her leadership continuously delivers measurable outcomes in cost containment and customer satisfaction, whilst fostering a culture of empathy, resilience and support throughout the claims process. And Di is well known to our chair, Judy Higgin, as the chair of MHCC, so has also presented to our board along with Alicia on a number of occasions. So thank you, Di and Alicia, and also just a brief on bio on Alicia, because I think they're going to tag in their presentation. Alicia also brings 20 years of experience in workers' compensation. Alicia is the client director of GSA Insurance Brokers, is a seasoned expert in claims management and strategic oversight. Her career has been defined by a strong focus on insurance performance, accountability, and partnership development, ensuring optimal outcomes for her clients. Alicia brings a deep understanding of the emotional and psychological challenges faced by individuals and organisations within the mental health sector, and she approaches each engagement again with empathy and care. Known for her analytical approach and commitment to continuous improvement, she's played a pivotal role in elevating service standards, reducing premiums, and supporting clients through the complex and often sensitive journey of workers' compensation. So I believe I'm going to hand over to Di first. Thank you, Di.
Thanks, Evelini, and thanks, Debbie, as well, for demonstrating that mental ill health and psychological injuries are no longer a silent issue in our workplaces. So they're now one of the loudest drivers of disruption, premiums, workload, deteriorating culture, I think, and concern for employers. So most of you are facing the growing challenge with the sharp rise in psych injury claims. They're complex, costly, often prolonged, leaving you as the employer frustrated by legislation that was initially set up to be reasonable, but perhaps may now feel very highly reactive and one-sided. So in response, the New South Wales government has introduced the legislative reforms, which are currently under debate. They're aimed at reshaping how psych injuries are managed. And while these changes aim to curb rising premiums and reducing the claims volumes, they also raise questions about, access to support, complexity, and employer responsibilities. So I am just checking. I am
sorry
sharing.
to interrupt. You are sharing, but then nothing's moving yet.
Yep, no, that's fine. I just wanted to. I'll move you on to the next one now, just to cover off. If it changes for me. There we go.
Yep, all good.
Perfect, thank you. So in today's seminar, Alicia and I will briefly review the current statistics and legislation which are driving the reforms, because I think there's probably a level of people involved who have a lot of exposure or little exposure to these claims. We'll then unpack what the reforms mean in practice, so how they could reshape the claims management model, what new obligations there will be for workers and employers, and then we'll just finish on some prevention and management to make sure you have support and resources within your business. Let's make sure this clicks faster. There we go. So as Evelini mentioned, Alicia and I have both been in workers' comp for an extended period of time. It feels very long sometimes. We've seen it all, from the tough conversations, the small wins, the big losses, and we're very passionate about helping employers. We're also very lucky to work alongside Charlie, who is the undisputed king of LinkedIn, and also has a workers' compensation background and brings a lot of energy and insight and a powerful voice within the industry. So we work closely with numerous employers within your industry, and we know exactly what you're facing. So just hand it over to Alicia to discuss Kids Express.
No worries. So GSA has a long-standing relationship with Kids Express, which just highlights, I guess, we're just not here to support people from an insurance perspective. We do have an understanding of the impacts that mental health claims can have, not only on individuals, but also how that extends into the community and to their family members.
Perfect. All right. There we go. Okay,
So why we... Oh, you go.
Sorry. No, it's all good. You go.
So the reason we're here today, I guess, is to discuss why the need for reform has come about. So I know, Debbie, you went through some stats, and this is just some more that are solely related to New South Wales. But the New South Wales scheme has seen a doubling of psychological claims over the last 6 years. Back in 21-22, psych injuries made up less than 7.5% of all claims, whereas now in 24-25, they made up 12% of claims. So there's been a significant growth across the scheme in the number of psych claims that are lodged. I think the other thing that's really important to flag is that psychological claims are projected to contribute 38% of the costs within the scheme in the coming years. So it may be that the numbers aren't growing at an exponential rate, but the cost of those types of claims are significant. And that's particularly around the next stat, where 40% of workers with psych injuries are still off work after 12 months, whereas 88% of people with a physical injury are back at work within 13 weeks. So the cost that that has, not only to an employer, but also to the whole scheme is significant. And how that follows on is obviously linked, again, similar with those stats that Debbie provided before, is in terms of the premium increases that people are seeing. So tariff rates have grown significantly within the whole scheme, but also particularly within your industries. So community health centres, home care and non-residential care services were hit with a 50% plus increase over the last couple of years. And that's obviously not sustainable. The other thing that's really important to note is that $1 on a claims cost can be a $5 or $8 premium dollar impact. So if you think a worker earns $1,000 a week that you're paying in their PRW when they're off on workers' comp, that's a $5,000 premium impact for 1 week off work. And if you multiply that by 12 months, it's a significant cost, not only to the employer, but to the scheme. So if we look at return to work rates, psychological injury return to work rates for the healthcare and social assistance industry have a return to work rate of 27% at 4 weeks. And that only increases to 73% of people being back at work after 2 years. So again, if you think about that from a premium perspective, if you've got that multiplication factor in there of 5 times at $1,000 for 2 years, it's a really significant number from a cost perspective. And it's particularly high when you then compare it to a physical injury, where 76% of people within the healthcare sector are back at work within 4 weeks. So that slide's just highlighting, I guess, the need for reform, both from a business and a scheme perspective. Thanks, Jo. You're just on mute too, Di.
Yes.
Thank you. I'll briefly go over the current psych legislation so we can then focus on the reforms. I think most people will be aware psych injuries need to be the diagnosed psychiatric disorder. That's the key threshold that everyone needs to meet. And we fully support the entitlement for workers who are exposed to traumatic events. And a number of your workers will be facing those circumstances as part of the industry that you're in. Our main concern with the legislation today is the application of Section 11A, which refers to reasonable management action. And the big issues we see for our clients are, as for example, workers who know they're going to go on performance management or performance management has just started. They will lodge a psychological injury claim on the basis that they were bullied and harassed at some point in the past that the employer has never heard of. And therefore, you can't really defend those matters. A worker's perception to events is key. A meeting and the way the worker perceives the circumstances are considered an event. Being in a conversation or having a joke that was taken badly is considered an event. Another big one is being put through a worker going through the performance management process and the Personal Injury Commission decides there was insufficient notice or warning or insufficient consultation, which all have resulted in the compensable claim, which I think has many examples, particularly where an employee should be tightly performance managed or should be terminated. The employee is doing the right thing to protect their other employees, their clients, or their business, and then the claim is accepted. So employees feel completely defeated and frustrated by the process. They think, the worker may feel vindicated that even though we feel the claim should be declined, it's being accepted within the scheme. Then on the other side, where those claims are clearly legitimate and due to events, they are taking an extended time to be investigated through factuals and independent medical examinations. And so their treatment and delays in return to work are impacting their results as well. So there's a significant need for reform. And I'll just go briefly onto the next slide, which is going through the proposed psych reforms. to click it several times for it to go. These are the proposed psych reforms. I've got these in here because I know this document was going to be a handout. So if you want to see the bills, you can click on these blue links and they will take you to the actual documents. So we've got the two bills that have been put forward. The Workers' Compensation Legislation Amendment Bill 2025 was put forward first. And as Evelyn mentioned, they've gone through inquiries and second level inquiry. The government has subsequently put forward the Workers' Compensation Legislation Amendment Reform and Modernisation Bill 2025, which was introduced to the lower house on the 6th of August. As Alicia mentioned, the cost of those claims is significant and the scheme is unable to continue to fund the scheme based on the way that these site claims are being accepted and the sheer cost that is coming through. So the government is trying to push ahead with some of these reforms, which bill actually gets finalised, we're not sure. It's about making that balance between supporting those workers who are on the front line, not impacting them at all, giving them every single support that they need. But on the other side, it's preventing those claims that are due to legitimate employer performance management circumstances, preventing those from being accepted where it's not reasonable. So I'll hand over to Alicia to run through the key items of the reforms.
So, as I said, the intent of the reforms is not to impact people who have been impacted by a traumatic event. And in a sense, the way that the reforms have kind of been split is though there's two kind of sections. So there's a relevant event, which is being subjected to an act of violence, threat of violence, being subjected to indictable criminal conduct, witnessing a traumatic incident, or vicarious trauma. And it's then split between that and relevant conduct. And this is where the bullying, excessive work demands, racial harassment, and sexual harassment come into play. So a relevant injury is a primary psychological injury caused by being subjected to either a relevant event, so the traumatic side of things, or relevant conduct, which is the bullying and that type of thing. And the reason I think they've tried to split it is so that it ensures that those people who are really genuine and have experienced a traumatic event don't have any issues with getting their claim accepted. And it's also then about trying to ensure that people who are potentially not quite as legitimate or who are going through performance management and then so lodge a site claim so they can't be terminated from employment, it makes it a little bit trickier for those types of people. It's really interesting when you read the initial reforms versus how it's now worded, and it's quite different, I guess, to the first time that Evelini and I caught up in terms of where we're at now, and it will be very interesting to see where it ends up when it's finally, I guess, released and it's all signed off. At the moment, there is an indication that for a psychological injury, there will be a six-week determination period, and during that period, the injured worker will have an entitlement to 75% of their PRW. If liability is then accepted, they'll be back paid up to that 95% amount, and it'll be ongoing like a normal claim. There is also the option that if liability is disputed for a relevant conduct, so performance management, bullying, that type of claim, the injured employee has the opportunity to then take that decision to the Industrial Relations Commission. If there is a finding in the Industrial Relations Commission, they can then take that back to the insurer, and the insurer has 7 days basically to overturn that decision. If the insurer then maintains that decision, the injured employee also has the opportunity to go to the Personal Injury Commission, which is the current kind of dispute pathway that is followed. So that kind of part is still, I guess, being determined how that will work, and it will be very interesting to see what happens. But there's also some other changes in terms of changes to the definitions around reasonable management actions, so Section 11A of the current Workers' Compensation Act. So they're planning to expand that definition and not limit it to appraisal or feedback regarding performance. There's counselling of the worker, demotion, disciplinary action, dismissal, investigation into alleged misconduct, promotion, provision of leave, provision of benefits, reclassification, or another action prescribed by the regulation. So they're trying to make that more defined so that, again, it is I guess, slightly harder for those people who are in a performance management process to get that workers' compensation accepted. I have an example where an injured worker was working from home, logging on for 5 minutes a day. And when they were logging on, I think one day they logged on for an hour and were actually working on their own personal business and not doing work. That injured worker still received 12 weeks of weekly benefits before we were able to dispute liability of the claim. And this is why this section of the Act is being really focused on, because I think the government has realised that businesses are entitled to performance manage their staff and then shouldn't be penalised by that worker then lodging a workers' compensation claim which gets accepted. A few other things that they're looking at changing is increasing the threshold for whole person impairment. So currently for a primary psychological injury, an injured worker has to have a 15% whole person impairment to be entitled to a lump sum. They're proposing to increase that to 25% from October 25 and then increasing that figure to 31% from July 26. They're looking at increasing the threshold for work injury damages as well to be in line with those percentage increases. So again, at the moment, if an injured worker is successful in obtaining a 15% whole person impairment, they can then lodge a work injury damages claim against their employer. There's also looking at changing the cessation periods or entitlements for weekly benefits. So under Section 39A, a worker with a psych claim would only have up to 130 weeks of weekly benefits, so 2.5 years. And if they wanted to receive weekly benefits beyond that date, they would have to have that 25% WPI. Again, it's just with the goal of helping people recover at work and getting them back into the workplace by really pushing those thresholds. Because if someone has a 25% whole person impairment, I think we can all acknowledge they're fairly incapacitated. And so it's still there to support people who do have that need for ongoing support beyond that period.
I think part of that perhaps is reducing those weeks is also for younger workers. So there's a higher number of younger workers lodging in psych claims, who are just going to be on the scheme for so much longer, and they really need to be encouraged to get back into the workplace. If their injuries, they obviously need assistance, but if their injuries are not as extreme as what they have, or what other workers have suffered. So supporting that return to work, because there is a limit to how long they can be in there. Perfect. Happy for me to move on, Alicia?
Yeah.
Perfect. Okay. So this is very high level around prevention and management. The big thing is about supporting these claimed reforms. So we don't know, as Alicia said, we don't know what the actual outcome is going to be in terms of what the legislation will look like, but we encourage you to continue to support the likes of Evelini and her team by putting pressure on the government, writing to your local member, telling them about the impact to your business without the psychological injury claims legislation going ahead. The more information that they have about actual impact to businesses, the more likely they're going to have this approval going through. In terms of prevention and early intervention, Debbie's report was fantastic in terms of the level of implementation of initiatives that you have, which is fantastic. And it's important to make sure, because you have this CIRA's psychosocial risk management code of practice that has been released now. So every employer must have your policies and procedures in place. We have employers who are contacted by CIRA and Safe Work New South Wales, Return to Work, inspectors who are going out and purely focusing on what your psychological injury prevention plans are. Are all those culture surveys and wellbeing initiatives. I think it's important to have those in place, but then also have that regular review point of, are they actually being taken up by the business? Is there actually any benefit to what we are doing? And continuing reviewing and amending those to make sure that there are changes within your business. The big one is, I think, upskilling managers, particularly if you're bringing in people who are previously as part of the team, and now they're going to be managing the team. They need to know how to manage their staff and say things appropriately, because pulling up conduct is really important, but how they say that is absolutely key to being able to prevent psychological claims being approved at this point in time. So regular education purely for management staff is really important to help prevent those psych claims. Focusing on workplace culture, it's now a formal process. So even just within GSA, within our organisation, we previously, we just had our Friday night catch-ups and things like that, whereas we now have a wellbeing culture committee. Alicia's on that wellbeing committee. Do you meet once a month, is it? Once a quarter?
Yeah. Once a month.
Yeah. And it's a structured process of these are our initiatives. This is what we're going to implement. Did they work? Did they not? What engagement did we get? And then it's those important conversations that your staff have, your managers have with their staff on those initiatives. Such and such raise concerns that they're having, issues with their family in the background. What can we do to support them? So it's just that regular check-in of you can't just manage their physical safety now, you have to manage their psychological safety as well. In terms of utilising a broker, that is to make sure that you get the relevant support that you need both on the claims and on the premium side of things. So any workers' compensation broker will have extensive case management or team leader experience in order to help you navigate through the grey areas of the workers' compensation scheme. They know how to push liability, when can we investigate, how quickly can we get appointments done to make sure that your claims, if they come through, if they're questionable, they are declined as quickly or as reasonably as possible, or if there's someone who's legitimate and needs support, that there's no delays in getting that through to them. On the premium side of things, I think that's really important to be able to help your business understand what exactly are we facing in terms of volatility or impact due to claims. So you sit down and say, okay, well, if we incur another 2 psychological claims like we had last year, what is that going to do to our business? And it helps you to get those figures through and budget, but also say, if we don't prevent these psych claims coming through, we're going to be potentially closing down our business because we can no longer fund our workers' comp premiums. Your broker would also have to look at premium volatility. So if you have 1 or 2 expensive claims, there's provision within iCare to say, a particular claim or claim should not have undue impact to an employer. So are you exploring all options for a premium review? The calculation is correct, but can you get it reduced because of the impact of a particular claim? So I think just overall, you'd utilise a broker to make sure that your workers' comp program is at the best health that it can be and you're fully informed. I think the main things I want to cover, Alicia, anything on the prevention and management that you think needs any particular point made?
No, I think you've covered it, Di.
Perfect.